In extreme heat, the human body works continuously to shed thermal energy. When physical exertion outpaces that cooling mechanism, core temperature rises. A person can be walking in formation 1 minute, then quietly lose the ability to track their surroundings and drift out of line. This signals a medical emergency with a very narrow window for intervention. You must identify the collapse and force core temperature down immediately using whatever tools are available. You do not need an advanced medical kit to save a life in this scenario. The most effective treatment relies on 3 basic items: a tarp, ice, and water. Having this gear only matters if you use it immediately. A patient's best chance at survival is treatment in the dirt before any attempt at transport begins. Step 1 is recognizing how the emergency presents. In an exertional case, working in the hot sun, breathing heavily, and saturated in sweat. In a classic case, the patient is stationary and indoors, with skin that has become completely dry. Regardless of the outward appearance, you must check for central nervous system dysfunction. Look for quiet signs of neurological failure rather than dramatic thrashing. Usually, the patient fails to visually track your movements or provides delayed, nonsensical answers to simple questions. Once you observe this confusion, confirm the assessment with a digital probe or an infrared scanner. A high temperature combined with mental status changes triggers the protocol: cool first, transport second. It is vital to ignore the instinct to rush the patient to a waiting ambulance. The air conditioning in a vehicle cannot drop a core temperature fast enough to prevent organ damage. The cooling must happen right where they collapsed. The fastest way to strip heat from the body is cold water immersion. Water conducts thermal energy away from the skin significantly faster than air. If you have a galvanized stock tank or a similar basin, fill it with water and ice. Lower the patient into the bath fully clothed. The wet fabric helps maintain the cold against the skin. This procedure introduces a specific lethal risk. A patient with neurological dysfunction cannot protect their own airway, making accidental drowning a possibility. To prevent this, you must assign one responder as the airway owner. Their sole responsibility is to hold the patient's head securely above the waterline while others manage the ice. Aggressive cooling is only safe when airway management is treated as a dedicated, isolated task. In many austere environments, a pre-positioned stock tank will not be available. You will have to improvise. Lay the patient on a tarp, have 4 responders lift the edges to form a cradle, and pour ice water directly over the chest. If a tarp isn't available, use ice sheets. Soak bed sheets in a cooler of ice water and wrap them around the patient's torso, rotating them frequently as they absorb body heat. You can also use convective cooling. Position a large fan to blow across the patient while continuously misting them with water from a hose or spray bottle. The underlying physics remain the same for every method. You must maximize the surface area of cold water contacting the skin to forcefully strip the heat away. Cautionary: because speed is the priority, do not rely on localized cooling. Placing small chemical cold packs on the neck or armpits will not drop the core temperature fast enough to save the patient. Never administer oral medications like ibuprofen or acetaminophen. These drugs do nothing for environmental heat illness and can complicate the patient's condition. Do not attempt to pour water into the mouth of an unresponsive person. Without neurological control, they cannot swallow, and the liquid will enter the lungs. When the core temperature remains critically high, the body begins to destroy its own tissues. As the minutes pass, this thermal damage causes the kidneys, liver, lungs, and skeletal muscle groups to fail as the heat breaks down their cellular structure. You must cool aggressively until the thermometer reads 102 degrees Fahrenheit. At that point, stop the intervention to avoid inducing hypothermia. Success depends on both the speed of the cooling and the discipline to avoid secondary injuries like aspiration or overcooling. Once the core temperature is stabilized and the organs are protected, the priority shifts to logistics. You can now dry the patient, wrap them in clean materials, and move them into the ambulance for transport to a hospital. In remote areas, a hospital is often hours away. The distance makes immediate field intervention the only viable path to survival. Success in these environments is defined by the treatment delivered in the dirt long before the patient reaches civilization. Providing definitive care at the point of injury is what prevents a heat emergency from becoming a fatality.